I'm Dr. Emily Swittzer. I'm a pediatrician with the Franciscan Physician Network in Dyer. Today I want to tell you a little bit about RSV. RSV stands for respiratory syncytial virus. It is a virus that goes around in older populations, has a tendency to cause a common cold, but in infants and in small children, it can be fatal and deadly, causing inflammation of the lungs themselves. Signs and symptoms that your child might have RSV would be increased work of breathing or struggling to breathe. So in little babies, that could be signs where you see their ribs starting to suck in when they're breathing, or even their head bobbing or nose flaring. That's a sign that their lungs are inflamed and they're having a hard time getting air in. If your child has RSV, or also known as bronchiolitis, there are a couple things you can do to manage at home. You can use nasal saline followed by suctioning, trying to get all those boogers out to make it easier to breathe. You make sure that your child is staying hydrated with plenty of fluids. You can also use steam showers or humidification. However, if your child is struggling to breathe, breathing more than 60 times in a minute, using extra muscles, particularly around the ribs, or sucking in around the neck and throat, head bobbing or nasal flaring, that's an indication to go to the hospital. In the hospital, they may require some oxygen therapy, something called high flow oxygen, or more suctioning with close monitoring. The FDA recently came out with a treatment called Beyfortus to help prevent an RSV bronchiolitis infection. This is a shot that gives antibodies to babies less than 1 year old or less than 2 years old if they have high risk or certain risk factors in order to prevent getting an RSV infection. As a pediatrician and a mom of a 6-month-old, I know I'm getting the shot for my son and I highly recommend it.